So, hi, John. We've had a couple of calls recently, and I know that you've had cluster headaches for many years. You've also been a supporter of other people with cluster headaches. And just recently, you told me that you've used DMT and it's worked for you when nothing else has. And I wanted to capture your testimonial to share with others because I think this is a very important piece of evidence. So,
Absolutely, yes.
can you just briefly tell us your experience with cluster headaches, how long you've had them, and what it's represented for you?
Yeah, well, I'm 65 years old now, and they started for me in late September 1973. So about 51 years I've had cluster headaches and chronic cluster headaches basically the whole time. So yeah, a lifetime of it.
And when you say chronic, that means you've had them essentially every day, several attacks a day.
Every single day for decades.
And what do they feel like?
The most unbelievably brutal, violent pain you could ever imagine. Every attack is bad. Uh, they're all bad, and some are just incredibly difficult to deal with.
Until recently, how many attacks have you been having a day?
I've been having at least 10 a day. For some reason, I'm just for the last. I came out of a 7-year remission, and as soon as I did, I haven't had a break since, and that was 6 months ago. I've been getting at least 10 attacks a day, every day. So that's over 1,500 attacks
Yeah.
um, every day.
1,500 attacks overall, you've calculated, you mean?
Yeah, since I get out of my remission in
Yeah.
6 months. Yeah.
Wow. Can you tell us a little bit more about the other medical conditions that you're suffering from at the moment, just to give a bit of context?
Oh gosh, yeah. Well, besides end-stage 5 COPD, I have adenocarcinoma, lung cancer. I have achalasia disease, which my esophagus swells up and ultimately causes me to aspirate food and causes bacterial pneumonia. And I've got multiple abdominal hernias from surgery. I had 20 major surgeries. I broke my back at the beginning of the year. That was caused by severe osteoporosis from steroids for my COPD, and I've broken my ribs 30 or 40 times in the last couple of years from severe osteoporosis. I can just cough and break my ribs. It's so bad.
Wow. How would you compare the suffering due to cluster headaches compared to everything else that you're experiencing? Is there a
I
way to
wouldn't
compare?
tra I wouldn't trade anything for cluster headaches. None of it. Cluster headaches is the worst pain I've ever had in my life. I've never felt anything worse. And I mean, including being terminally ill and breaking bones and just so many other really severe, painful conditions. But cluster headaches is in a category by itself. I've never felt anything like it. It's such severe pain. It's literally violent, screaming pain. And to put it bluntly, it feels like you're being murdered. Uh, it's an unbelievable pain. And you expect to see blood. And I think when I telling people about my first attack, I thought I was shot in the head. I thought somebody shot me. And I was dying. I felt every attack pretty much feels like you're dying. It's just horrible, horrible pain. So no, I wouldn't trade any of it for cluster headaches.
And what medications have you tried, and have any of them worked for you over the years?
I've never had a single medication from the medical establishment that worked. They either didn't do anything or they made them worse. And that was the first 5 years, 6 years of having them. I saw many doctors, and they couldn't even tell me what I had. but they kept giving me medications for migraines, and none of it worked.
What about sumatriptan, which is one of the standard abortives that's prescribed?
Yeah, that's an abortive, and I did try that. It it worked. It stopped my attacks really quick, the injections, but within no less than 30 days, I started getting severe rebound attacks. It was doubling the amount of attacks that I was normally would get, and making them worse. So I had
Yeah,
to stop using it.
yeah, I've heard many cluster headache patients reporting the same issue with rebound attacks. Have you tried psychedelics like psilocybin or LSD?
Yes, I tried psilocybin 3 times for my clusters, and it worked every time. Um, the first one had lasted about 6 months, the second about 8 months, and the third about a year. And then because of my health and having severe issues with pain, I was on a lot of pain medication, and they basically work together with the same receptors in the brain, and it wouldn't allow the tryptamines to work, the psilocybin or anything else.
So you have continued to try psilocybin and it was not effective anymore. Is that right?
Yeah, it wouldn't work for me anymore with being on all the narcotic pain medication.
Okay. Um, and you do use oxygen. That does work for you, high flow oxygen. Is that right?
Yes, it's been a lifesaver for me.
Yeah.
But it takes about 15 to 20 minutes or so to abort an attack.
Yeah. So DMT is a small molecule in the same chemical family as psilocybin and LSD. And for people who don't know, it's the active psychedelic component in ayahuasca, which many people take in ritual ceremonies in the Amazon, and people often have life-changing experiences. Um, what made you decide to try DMT?
Well, I'd heard about it for quite a while in the cluster headache support group I've been in, and I talked to many people that tried it and swore by it, and I just never had the ability to get it until now.
Yeah. So, can you tell us your experience now using DMT?
Oh, it was wonderful. It took me a few attempts. It came in a vape pen, and I'd never used one before, so it took me a few times to figure it out and how much to take. I was told to just take one puff, and it wasn't working very well. I wasn't getting any hallucinogenic effects, and I thought, well, maybe it's the same problem I was having with psilocybin. But ultimately, it took 4 puffs, and that triggered the hallucinogenic effect. As soon as that kicked in, it instantly stopped my attack. I mean, instantly gone. No pain, no nothing. It was
Yeah,
gone.
that's incredible. Um,
Yeah.
one thing I guess is worth pointing out is that it seems that for psilocybin and LSD, the psychedelic or hallucinogenic effect itself is not actually necessary. There's a non-hallucinogenic analog of LSD that also works. So there seems to be a distinction between the hallucinogenic effect and the actual preventative or abortive effect on cluster headaches. So do you feel that when you're taking the DMT that there's a relation between the hallucinogenic effect and the ending of the cluster headache, or could it just be coincidental? Do you have any insight into
Well,
that?
yeah, it's hard for me to say because I'm so new to it, but that seems to be what happened. Soon as the hallucinogenic effect kicked in, it stopped my attacks and all the pain and everything was just gone.
Yeah.
But until then, it wasn't. I mean, it wouldn't stop it until I felt that hallucinogenic effect kicked in.
Yeah.
But that
So
was only just like a minute or two.
yeah. So there, I mean, it may well be that both things are happening simultaneously, that you're getting the hallucinogenic effect and it's also at the same time having a direct abortive effect on the cluster headache.
Yeah, yeah. Uh,
Um, I just want to ask you, would you consider there to be any side effects? Would the hallucinogenic effect be a reason not to take it in your case?
Not at all. In fact, it only lasted about 15 minutes from when the hallucinogenic effect kicked in. 15 minutes, it was gone, and so was my cluster headache. And I had some lingering, maybe a little bit of lingering overall body effect, but it was very mild, and it too only lasted not even 30 minutes.
Has it reduced the number of attacks?
It seems to, like I said, I'm so new to it, but on the third day, um, I only had 4 attacks. That's the first time in 6 months that I didn't have like 8 or 10 attacks at least.
Is there any reason why you're not taking it to abort every single attack?
Um, it's pretty strong, and I'm having so many attacks a day. I would, and plus it's not. It's a little bit expensive, so I can't use it for every attack. If I have 10, that's a lot of medicine. Um, and my plan was to split the aborts. To abort each attack between my oxygen, high flow oxygen, and then DMT. But if it seems to be cutting my attacks in half. I only had 4 attacks, so if that's the case, and I'm getting less attacks, I'm thinking there's a possible remission coming. And that's exciting.
Yeah, I'll bet. I mean, 4 attacks still sounds like a lot, but if you've been having 10,
Yeah,
that must feel like such a relief.
a big difference, that's for sure. Yeah. I'm looking forward to trying more of it. I'm waiting for more to come.
Yeah, no, I'm sure. Actually, the last question I have for you is what message would you like to give to legislators or regulators in terms of the legal status of DMT?
Oh, it absolutely needs to be used. Um, it's, for this, especially cluster headaches. I've never had a treatment so effective and so with no side effects whatsoever.
Yeah.
It's amazing, and the DMT, psilocybin, any of the tryptamines, they all seem to work so well to stop this horrible pain.
Yeah. John, I really
Yeah.
appreciate your yeah, taking the time to share your experience with us, and I wish you really all the best.
Well, thank you. I look forward to using it more because I'm not educated enough yet, but it is working fantastic, and I'm very excited about it.